touching, I would say skin to skin is really forefront for us because, there's enough evidence to show now, and there's many papers that have been published to show that skin to skin care is very, very useful and helpful even in the sort of the immediate sort of outcomes for a baby, and also further, down the line, their neurologic and developmental outcomes. So we do try to encourage skin to skin care. Obviously, we understand that sometimes the baby is not very stable yet to be, taken out of their incubator, put on the parent's chest. But if that is the case, we allow them to do more of the touching, containment, and other things that the nurse and the therapist teach the parents to do. They can do other things while we're still waiting for this whole lot of hands-on care. Like they can read to the baby. We encourage singing. We try to get music therapy involved as well, like so that they can do some things. Once we are able to start touching the baby because they're more stable and they're doing well, we actually encourage the infant massages. We have a massage therapist that can come and teach you, especially our therapists are the ones who teach them to do that. We actually want them to start doing daily cares, like, doing diaper changes, maybe start giving them a bath or things like that. When they're in a place where they can start taking oral medications, we actually start encouraging parents to start doing that as well, so that they feel comfortable doing this. We also want them to start learning to do the different kinds of exercises a baby should be doing, because as you can imagine, these medically complex babies, you're probably scared to touch them sometimes or maneuver them in ways you would do a typical term baby who's at home. So we want them to start being able to get comfortable with that process. So we start that as early as we can.